Good evening, everyone. This is 343 podcast, which is a brainchild of our Foxy President, Dr. Sunita Tandulwadkar, Madam. Today, again, something comes very uniquely in my life, and I must say, because the today the two persons whom both of us are going to talk later, but the instrumental part of my journey starts with both of them, and both of them are the unique in their two things. First is the endoscopic skill and organization skill. So I make this topic interesting for all those who are listening, that making of a medical leader from the operation theater to the organization skills. So these two people in my life, they taught me how you can balance between the professional life and the organization skills you can have. And madam, I really owe my life, and I will be uh, really honest on my opinion that whatever I am today, I'm learning every single day from you. No matter where you are, no matter in whichever situation you are, you make it a point that 8 o'clock you will be there, and you've given us such a beautiful platform to all of us. Those who really don't know how to talk to the people, they get the confidence, they start making conversation, and it is not our fraternity. We can talk to our leaders. We already has an interview with the uh, ministers also. Madam, it's really a pleasure having you here for this podcast.
Thank you, Ashish. Thank you. And welcome, Kalyan. I join every day, 8 p.m., 343 episodes. It's like na bhuto na bhavishyati. If next year someone says me, I will say impossible. But we all had decided we'll do. Though my joint secretaries, they warned me, are you sure you will be able to do that? I said, once decided, I'll do that. My worry was my chairperson, whether they will be able to take this podcast. Doing entire project on their shoulder, and they did it fantastically. Every chairperson on that day dot, they will be there. They have never exchanged with other chairperson, and I'm really the way they have taken interviews in February and now in December, it's a absolute 360-degree turn. They are so confident, their body language is so comfortable, and I'm glad because these are our future leaders of organization. They are the one who will take the organization up further. Having you, Kalyan, is another beauty, very dear friend. For years together, we have worked. We have so much of a mutual respect for each other's work. And coming on a Foxy platform when you are not on a chair of a Foxy is a beautiful thing. Though I know your heart belongs to Foxy as well as endoscopy like me. Thank you so much. Our pattern is only both of you will have a dialogue, and I'll be joining the viewers link. Ashish, you are a very dependable and very committed. You don't know how to express yourself, and that's why, in spite of doing such a huge work, probably there may be misunderstanding. Kalyan, I would like to tell you one thing about Ashish. I was supposed to be on 6th November in Agartala. From Agartala, traveled to Guwahati. From Guwahati to Shillong. And I was little bit worried because 2 days travel in that eastern part where the evenings happen at 5 p.m. only. It's not very safe. I was told after 5 p.m. to travel, and by no connectivity, I can reach to the respective places if I don't travel in the evening. I just gave a call to Ashish. Ashish, 5 days of my this traveling, you will be with me. We are leaving on Wednesday, Thursday, Friday, Saturday, Sunday, but all will be back home. And I told him 4 months ago because he is also busy in his practice. And my comfort was because he's postgraduate from East India and he still goes for a consultation and for his practice in East India. So I know he knows entire all those states. Believe me, Kalyan, he just marked the date. No words. He accompanied. Later, I realized he had no roles to play. mine संपूर्ण project ministry के साथ in Shillong another ministry के साथ and everything, but only for my comfort or a safety you can say he traveled because he knew how important my meetings with those ministers and those government authorities. So I just, these small gestures, it touches you. That shows the humanity, that shows the integrity of a person. And I love you. Always see yourself in a very high position, Ashish. And I will enjoy the podcast from other end. Thank you.
Thank you.
Thank
Thank
you,
you,
madam.
madam.
Ashish is the most dependable person we have seen since last 20 years, and he has a bright future in IAG, Foxy, and ISAR itself. Thank you.
Thank you.
Thank you, madam,
Bye
for
bye.
your those words, madam. It is a short whatever I done. It is nothing. Everything of mine, madam, till the last breath is over to you. You know the reasons, and I'm very honest to you, madam. It is nothing to just to talk. Because I'm not good at talking, and there are certain things that comes but I cannot express. So thank you,
I
madam, for being
understand.
there.
Thank you, Ashish. And bye, Kalyan. See you in
Ma'am,
next
bye bye.
week.
Yeah.
Next.
Good evening, everyone. So we have a very esteemed, dynamic leader. And when you talk about the leader, one should be knowing about the qualities we know. But see, from the operation theater to organization building, and I today on 343 a podcast episode, this is going to go to all the Foxians and those who are watching it live. And I come into this mind, and then I thought there is only one person whom I can talk to, and there is only one person who is apt for this talk because he is operating from day in and day out, and still he is organizing the buildings of organizations, and he is the president of IIG. He is a past chair of Public Awareness Committee of Foxy. He is MSR, Managing Committee member. He is a many more to his credit. He is a vice president of IMA Maharashtra, but nothing less than that. He is a very good human. He is a good. Uh, I can tell you one thing to all that when you talk to the person, he always talk from his heart. And today, if I'm a family welfare chairperson, I owe this chairperson to one man, is Dr. Kalyan Baramade, because he's the person who just called me up and tell me, Ashish, if you wish to go, you can, otherwise you leave it. So welcome, sir, for this podcast. And it's really a pleasure of mine to have you. This is being a last podcast of this year. And I'm happy that the Foxy really needs the leaders like you. And under the leadership of you, the Foxy will cherish, sir.
Thank you, Dr. Ashish Kale, for these nice words. And I'm really happy to be here in Foxy Podcast. I had worked in the past from 2019 to 2022 as the chairperson of the Public Awareness Committee. And we have started this drive called as the Save the Uterus. There were some cases going on in Maharashtra Beat district where authorities were telling gynecologists are responsible for unnecessary hysterectomies. And that time, Dr. Nandita Palsetkar, who was the president, given this responsibility to me. And then we had a drive across India to sensitize all gynecologists across. And Ashish, I'll be very proud to tell you that out of 248 societies, I have traveled in 160 societies in those 3 years. And with Bayer initiative, we had taken this as a Save the Uterus, which later converted in Dr. Shanta Kumari Madam's tenure as Preserve the Uterus. And I'm happy that this drive is continuing till date today. And I'm proud to say, because of the Nandita Madam, I am the pioneer of starting this initiative of the Save of the Uterus. Thank you, Ashish.
Yeah, Dr. Kalyan, we will go. The questions will be not given to any of you. The questions will be from the life lessons and the position you achieved in the organization. As Dr. Kalyan, everyone knows that you postgraduate yourself from the city of Mumbai. What makes you to come down to the city of Latur? And when we called as a Latur, hardly the people know because only we know the political giants are from there. But from the way you come up like the Phoenix, yeah, the only now name in the organization comes when there is a Latur is only Kalyan Parmade. So How it makes you feel that coming from the GS and that to be a Mumbai, again coming back to your the Latur, the setup will be different, the cities are different, your lifestyle is different. How you make yourself comfortable in Latur?
Thank you for this question because I have been graduated from a Marathi school from Latur, and then in 12th I got 99.33% marks in 12th exam, and I was 8th topper of Maharashtra. So I got the best college in Maharashtra, that is said GS Medical College. My entry year was 1992. From there, after MBBS, I did my DNB, DGO, FCPS from KM Hospital. While I was doing my registrarship and lecturership, I met a wonderful person, Dr. Neeta Verti, who was a gynec endoscopic surgeon and who had come to our KM hospital to demonstrate one laparoscopic hysterectomy and one laparoscopic myomectomy. I was the one from vernacular background. I was the one who was carrying her bags here and there. And then at the end, I just inquired, ma'am, can I learn endoscopy from you? And I think that is the turning point of my life. She allowed me to be with her for 1 year. And while we were doing the freelancing in Mumbai itself, we got opportunity to meet Dr. Firoza Parikh, who was doing IVF in HN Hospital that time and Jaslok Hospital, where we used to go there to operate her cases. That is how interest in IVF developed. So I was there in KM with Sanjayani Endoscopy Center, with Nitawati, with Jaslok and HR, and then I got slightly perfect in endoscopy as well as IVF. Then that was a time when I thought of going back to my native place because there was nobody who was doing endoscopy, there was nobody who was doing IVF practice, and that was the need of a time because I come from a background where my father was a government officer and we were five children, out of which four were doctors. So it was a time to give back to the society. Ashish, I'll be very proud to say I got only uh, money from my parents was till third MBBS. From there, everything is been earned in KM Hospital. That is money as well as my expertise in KM Hospital Mumbai, because we call it is Ganga. It's like a Ganga where it is a lifeline of India. That's how KM Hospital Mumbai is a lifeline of gynecology and obstetrics department. And from there, I had never looked back, starting from a two-bed hospital to now 50-bedded hospital. And we have two IVF center, one in Latur and one in Hyderabad. So I thought to give back to the society. In initial period for 2 years, I was feeling very frustrated because people were not knowing what is endoscopy. They were giving 4,000 rupees to do a hysterectomy, that is open hysterectomy, and I was asking for 5,000 rupees as a package. Nobody was giving that also. So in initial 2 years, I was workless. I got frustrated. I got opportunity to give exams and I cleared my MRCOG part 1. But that is the time after 2 years, my practice started growing and I just thought of being in a place that is my native place, born place, Latur, and I'm doing quite well. And I'm happy that God has given me opportunity to work for the people of my place, my village, and now it has become a big district place. And we have now 12 IVF centers in Latur in 2025. So all I'm really happy that I'm back to my place.
Dr. Kalyan, when it comes down to the now we'll go to the another side of your career. When we talk about you in a IIG or for that internationally, you recognized for your skill of beautiful hysteroscopic surgeries and fertility enhancing surgeries. How the interest develop? And secondly, I know I've been in your theaters very few and frequently. I got a pleasure of operating there when there was a conference. But in the city of Latur, everything is available, and that to be in your private setup. What makes you that carving coming up that I should have this, I should have a I have a 3D, I should have a again the
Hello,
robot
Ashish.
also coming down. Dr. Kalyan, yeah.
Yeah, so what happens, when I was in Latur,
Your internet connection support team?
Yes, sir. His internet connection issue.
Yeah, internet connection was some problem. Yeah.
I think there was some internet glitch.
Yes. Yes.
Yeah. So when I was in Latur in 2004, that was the time when we started hysteroscopy and laparoscopy in Latur. And because I was inclined towards the IVF, we did a lot of hysteroscopies. I was the first one to do hysteroscopy and laparoscopy in Latur. And I'm proud to tell you, I have done more than 25,000 cases with zero complications. All the complications were managed in the operation theater itself, but not in the battleground of legal issues. So that was a time when I was going to Mumbai often to meet my teachers in endoscopy. The interest developed of doing a conferences and all. And when Dr. Nandita Palshetkar became IIG president, she started with a drive called Yuva IIG. And that is a time when you all came to my hospital, which was a 50-bedded new hospital, and we did wonderful UA IG conference. And you will see, I'm very proud. Everybody operating faculty was UA, and all of them are now stalwarts in endoscopy, like Dr. Ashish, Dr. Nitin Shah, Dr. Anurag Bhate, Dr. Pandit Palaskar. Everyone who came for that conference as UA are now established people. When you talk about the hysteroscopy, that is my passion, because when you work in an IVF center, you need to preserve the endometrial cavity. That is very important. And all these studies have done that minimal trauma to the endometrial cavity will give maximum output. Also, because in my rural India, the tuberculosis was very common. I encountered many patients of Asherman syndrome, and that is how these were the patients who made my skill better and better. And today, we are very proud that AAGL, that is American Board, has given IAG a platform at international level, and we got 1 hour session where five of our faculties got enough time of 10 minutes to preserve their work, present their work at AAGL, and that is what is important. A person from small village reaching to America for giving a talk, that is what a true India means, that is working at the level of village, but working off standards of international level.
Sir, there is another question when it comes down to Dr. Kalyan. Is whenever you are from the city of Latur, and now you are traveling across the India and across the globe for your commitment to the organization. My topic starts with the from the operation theater to building the organization skills and making the leader in medical practice. Sir, when we talk about the Latur, there are the certain prominent faces come up, and the prominent faces and the organization comes is IMA, and then the IIG and the Foxy, of course. But sir, when you're talking about the IMA, it's just a huge organization. It's a different altogether mindset. How you mold yourself when you are an endoscopic surgeon to IVF specialist, and there are the certain things that you need to come down to the different pathies, talk to the different people. How you manage that? Because I've seen you from different majority of the functions where you felicitated by esteems in Laturs. I will name a few of them like Amit Ji Deshmukh and all the stalwarts in the political leader also. Sir. How you manage?
Dr. Ashish, yeah, Dr. Ashish, I am very happy to tell you that I am very social person. My OPD is quite good, and I am very attached to the people of Latur because I started with 50,000 rupees and maybe I am now a crorepati. So what made me this is only because of the blessings of my people, that is people of Latur. We had two incidents in our region. First was earthquake in 1993, which shattered and thousands of people lost their lives. And we had
Sorry, it's
doctors
again
to
the
do
internet. Yeah.
the work in the rural India. The second thing happened was in 2016, we had a lot of drought. No water. The water came by train to Latur. And that is how we started something called as Go Green Initiative. And there is foundation which is done by 5 of us called Latur Green Vraksha. So we have done plantation of more than 2.5 lakh trees till today. And we are working non-stop since 4,000 days. So that is what is very important. Early morning we get up at 5 o'clock. 5 to 6:30 is the time to do a plantation. And to preserve these trees, we do watering of these trees also. That is how I am connected to the grassroots level. And when I became IAG president, we have done this initiative of Go Green, and we have planted more than 25,000 trees by IAG members. So that is what is very important, giving back to the nature. Because you are doing well, you are now a software person, but the trees are getting cut. You need to plant these trees, nurture these trees, get lot of oxygen for our future generation. That is what is motto of my life. And that is why I am really connected. And when you are connected with the people, there were two incidents of violence against doctors. One of the pediatrician got skull injury. And that was the time when I was a IMA secretary. And we whole Latur Bandh for 2 days. We made those criminals to get arrested. And that was the time I got really with the people of Latur district that somebody who is there to care for the doctors needs to be nurtured. And that is how I got elevated as post of IMA president. And now today I am vice president of IMA Maharashtra. This is all because of the blessings of doctors of Latur, for whom we have done lot of work like MMC registration in my hospital. Violence against doctor team is initiated where you have to call only one person, he will call 10 other person. Any mob violence is there, we 100 doctors go to that place. He has to call only one person, he will call 10, he will call 10, he will call 10. Last month only we had two incidences where around 200 doctors went to that place, and everything, as you know, if mob has a mentality to do something wrong, if doctor mob has gone there, they will also understand the topic very nicely and all the things will get clear. I want to emphasize only one thing: be transparent in your practice, talk to the patients. Talking in your consulting room for longer time will decrease your time in the course. That's what I feel.
Dr. Kalyan, that was a really a take messages for all the members who are listening us live. But when we talking about when we come down to now the professional things, I seen like catching you a flight at 7 o'clock, but doing your surgeries at 3:30 a.m. in the operation theaters, finishing everything. Even if there was, I remember in the COVID times, I mean, you was a committee chairperson. There was Zoom meetings, and still you are doing the cesarean sections and the endoscopy, and just in a minute or so you will get ready and start a webinar. How you manage your profession when you are talking about the organizations?
I'm really happy that my wife is a gynecologist. So that is another advantage. We have a team of another two gynecologists with her, so that we are totally four gynecologists working in a 50-bedded hospital. We divide our duties that way. And when you talk about the work, we have to divide the work properly. Since last 5 years, I am doing only endoscopy and IVF. My wife and her team does obstetrics, ultrasound. Every day, one OBGYN is on call in the hospital so that the proper care of your obstetric patients is being done. And I am doing all the elective work. And I am also on call once a week. And every fourth Sunday, I am on call. So what happens nowadays, because of the Consumer Protection Act, doctors are also liable to get punishable. So Consumer Protection Act got by government has really strained the relationship between patients and doctors, because now they consider as consumers. Consumers have their own rights. So what we do in our hospital is taking prior consent, taking procedure specific consent. I'm really happy that the medical legal team of Foxy and IAG is so active and they have got all the consents ready made for all the procedures. You have to train your staff adequately so that they put proper papers. And whenever there is a high risk patient, we do in video counseling for this patient. What happens, even if that recording is not going on, they know that you have enough evidence for that case, that high risk placenta previa you are operating, any multiple fibroid myomectomy you are operating. You are told them about the PPH and other complications, need of ICU care. Patient can become serious because her bilirubin is high. So that is
Mm.
what is very important. Talking to the patients. So we are now a team of 4 gynecologists working in our hospital. That is why it is possible. My advice to the people who are single gynecologists working in a small nursing home, please involve your fellow gynecologists for any of the surgeries you are doing which is a high risk.
Mm.
Secondly, please reserve the blood for any of the obstetric patient. Don't be in a say ki nahi, I have delivered 10,000 patient, no death. Any day death can happen, any day PPH can happen. So please do reserve the blood. Thirdly, what we have gathered is please do CBC with platelet, liver function test, BTCT and PT-INR for all obstetric patient, whether it's an emergency, elective or whatever. And whenever you have high risk patients like polyhydramnios, twins, RH negative, please make them sensitize that this patient might require lot of blood and blood components and might have to require some others gynec friends to be getting assisted for such surgeries. People doesn't have problem in paying. We have a mindset of becoming hero by charging less. Please charge adequately for your services. Or if Dr. Ashish comes to my hospital to assist for a cesarean, please pay him adequately so that next time Dr. Ashish will come to my hospital with happy faces and not. So that is what is very important, that for single gynecologist, you have to plan your surgery. Secondly, please do your sonography yourself. She has got all centers where you can learn ultrasound. Please at full term do a ultrasound to know unexpected placenta previa, unexpected placenta accreta. I am doing routinely GDM testing at 26 to 28 weeks. Please do so that you are not going to miss any GDMs, any shoulder dystocias, or any polyhydramnios. And please do minimum 5 sonographies in whole pregnancy so that her obstetric is going to be a good, because what relatives want is healthy mother and healthy baby at the end of the pregnancy. And if there is any untoward complication, please be transparent. Involve your gynec friends, involve anesthetists, and involve pediatrician for each delivery. And that has caused I have done more than 20,000 deliveries, and I'm happy no medical legal case till date, only because of working safe in whatever setup you are. And if you're working in a small taluka place, please don't take high risk patients. Arrange a day where you can go to a district place, operate with a person who is your good friend, and then you can be safe, because it's always be safe than sorry is better.
We aptly made this podcast is a Gyan Pravah, and the words coming from the leaders make the people understand that how the things can be manageable at a larger scale, and that to be when you are listening to the words from the people who really has the enough of experience and so many years of experience, that experience teaches the juniors in a future learn. Dr. Kalyan, when we are talking about now coming down to your personal things and personal and familial, I will now take this chance because today I am the host, and that I can take those perks when I'm going to have the interview with you. I wish to ask you that whenever you are outside, you always told us that you have a wife and she's a gynac. But what is the bond, the leader, when you are a leader and you are going away from the families? I know both of your sons are one is already a doctor and second is going to go into the medicine. And a single person who is managing the back end and that stress, and the person who is going and doing the surgeries maybe in the workshop, but still at the back of the mind, someone is else is taking care of. How that bonds come up? Because you are now as a medical leader, we wanted to hear.
Basic thing is, my wife, Dr. Manisha, has learned everything from me itself. So she knows what are the protocols. Secondly, what in our hospital we have done EMR system where everything, all diseases, all surgeries, protocols are being made. Anytime, any difficult surgery we are doing, another gynecologist has to assist. If I am doing any surgeries on the Friday, someone is going to assist me, whether my wife or some other gynecologist, so that she knows or he knows what I have operated. Thirdly, anytime you are doing surgery, please settle the issues of the patient there and there on the table itself. Even if you take 2 stitches more, that is not be counted at the end of the day. And even if you are going to do a hysterectomy laparoscopic in 40 minutes and in 2 hours, patient doesn't need the timing. She needs that your safety is prime concern. So whenever you are doing surgery, please be cautious. When I go every out of 4 weekends, I travel 3 weekends to many of the IAGE conferences. And because of the stalwarts in IAG like Sunita Tandulwadkar, Dr. Bhaskar Pal, Dr. Pandit Palaskar, and other stalwarts, Prakash Trivedi, all have taught us one thing, that whenever you are doing surgery, do it meticulously, do proper dissection. Whenever you are in a proper plane, bleeding occurs less. So we follow the surgical principles properly. So that is what is very important when you are traveling or you are a mobile surgeon. Thirdly, whenever a high risk patient, I operate on Monday, Tuesday, so that I am there for till Friday for these patients. And lastly, you have to take adequate care of the patients whenever you're going out. I tell to my patients that a equally competent gynecologist is available as I'm leaving the town. On my
Yeah.
hospital board, it is mentioned Dr. Kalyan is out of station from Saturday, Sunday. He will be joining on Monday morning. That transparency counts, because what is happening in our practice, that ghost surgeons are coming, people with limited knowledge are doing larger surgeries, and that is what is not accepted by the patient. If, like doing an endometriosis surgeon, I know Dr. Ashish Kale is very good endometriosis. I have seen him operating. So what he does, first he will do a retroperitoneal dissection. He will safeguard the ureters. Then he will go to the uterine and then do the surgery. He will open the pouches. He will go into the pararectal fossa, paravesical fossa. So these are the dictums of any of the surgeries. Like that, a life has to be defined properly. Whatever you are doing, you have to mention like a protocol, so that anything goes wrong, you have a plan B ready for these surgeries. So I go on Saturdays. I have a Hyderabad airport where it takes 5 hours to go from my place every Saturday. And every Sunday night, I'm traveling from night 8 o'clock to 2 o'clock in my place to reach in the early morning. But I'm not worried, because my team who had assisted me are informing. And lastly, we have a WhatsApp group of the hospital where all patients reports are being sent every 4 hours on that group. You have to just in between see the mobile so that everything is happening right. So ultimately, for safe medical legal free practice, you have to respect the principles of the surgery, and you have to respect a patient considering she's your brother, she's your sister, she's your mother, or she's your aunt. If you have that feeling, I think you can have a good practices. The newer generation is being very fast. I'll tell them, be slow. ये आपका भी टाइम आएगा, तेरा भी टाइम आने वाला है, हर एक का टाइम आता है. और साई बाबा says श्रद्धा एंड सबूरी. Just keep faith in our obstetric practice and be patient. That is called saburi. Everyone is going to be successful. And please have your association, Foxy association of your city, very strong so that in case of any of the help need, people should come to you running. And for that, you need to be active in your IMA activities, Foxy activities, and even IAG activities so that you are well connected to the people. And lastly, I'll say make one guru in your life where you are learned everything. In initial phases, send him or her your videos, what you are doing. Please share your complications with your guru so that he will tell you how to be safe in the practice. In initial period, everyone makes small complication, but they should not be life threatening or complicating the life of the patient. That is what is very important. Whenever you are doing a hysteroscopy, people feel hysteroscopy is very simple. No, you are doing surgery with only one hand. In laparoscopy, there are two hands, assistant two hands, so four hands are there. So choose your cases wisely in initial days in your practice so that you are well versed with the complications that are happening. Have good instrumentation in your operation theater. Have good senior anesthetist in your theater so that he can
Mm.
judge what you are doing. And lastly, in hysteroscopic surgeries, every 10 minutes, somebody will be looking after the fluid deficit, what is there, so that zero complication can be managed. Please use EtCO2 monitors for laparoscopic surgery. Keep extra cylinders of CO2, keep extra light source, keep extra scope, so that if any of the instrument goes off or not working, another set of the instrument is there. Please autoclave or your autoclavable instruments or have at least EtCO2 monitor in operation theater so that you have least complication and you are medico legally safe if there are any complication happens.
Okay, and now, Dr. Kalyan, it's being a 40 minutes that we are talking to each other, and we are taken the so many sentences from your talk and some of the take-home messages that makes a life easier for OBGYN. So coming to the you're now the personal, only a personal things we wanted to ask you very short and simple. The homemaker to the person who is from the family person to the person of the organization and the person of the universe. What is the common in that person? What is the
Support from
quality that
family.
is common?
I think support from my family is very important for anybody to grow. Your spouse or support system has to be very good, maybe a hospital or anything. Your support system makes you comfortable and will keep you always guide you a right path so that my field first is support system. Secondly, I say you have to have one guru so that your spiritual power is there whenever you are in a dilemma, whenever you are in a stressful period. And thirdly, I say friends. Friends are the one who are the stress busters because what happens, any stress you can share with them. So the common things, I'll say three common things: support system, a guru, and lastly, friends.
Now, again, the second question, because I'm having a very few minutes now. The second question, I seen your happy face in the operation theater. I seen a much more happy face when you have a farm land and you are with the in a farm. So, what is the best thing you like? You like the greenery or you like the
Uh,
red color?
I think I like Monday to Friday, I am a red person, and on weekends and holidays, I am a green person because I have around 80 to 100 acres of land near about Latur, and we have all greeneries, all food items make from jawar to all sabji come from my farm. From milk to paneer, everything is from my farm. I just buy soaps and all the things, paste. That is what is my uh, expenses around 4,000 a month. Everything comes from my field because Go Green is initiative and chemical free food, organic food is very important. What we have learned from Corona is those survival of fittest. Those people who were good by health have survived, those other have not survived. So live your life simple. Eyes require greenery at least twice in a week. Go around with family to the green field, and your life will increase by minimum 10 to 20 years. And walk barefooted in your field or farm so that you get regenerated.
Now, again, the personal question, the third question, I think. When you're talking about the Dr. Kalyan Baramade, president of IIG, and I seen him going to the Mumbai for any kind of meeting, but he makes sure that he will go and visit his son who is studying as a medical profession. What is that bond? And the person who is seems to be a very jolly becomes very studious when the it comes down to the son's education. So how that change, Dr. Kalyan will
Being
happen.
a Dr. Ashish, being a parent, that happens with everyone. Maybe when your son goes to college, you'll realize that. Secondly, I come from very smaller background, very problematic because we were five people studying, and now we have only two sons, and they got admission in the government college in Mumbai. So that is what is very important. I feel proud in the era of this NEET exam with lot of competition, they got admission in the medical college. So whenever I go to IAG office or any of the conference, I make a rule to meet him for at least 20 minutes, 30 minutes, or call him in the hotel room so that we can share the time. That is very important. Thirdly, what happens, he feels that fathers are always practice oriented, they're always in the hospital. So that is a leisure time where we can spend a lot of time with him. And I make him meet my friends like Dr. Ashish, Dr. PC Mahapatra sir, Dr. Sunita madam, so that they also learn a lot from these stalwarts of endoscopy. That is why I make him come for these conferences and I meet him often.
Dr. Kalyan, I feel there is a common thing between you and your son that both of you are attached to your fathers. Because I've
Yes.
seen you, your closeness to your father, and it's the same thing in the generations to come. So
Yes, I
like
lost
the
him in
fourth,
COVID second wave, so I really feel bad that we could not save him in the second wave of COVID, but he was a diabetic and CKD patient, so we could not save him. But now, whatever quality time I have spent with him, the memories, because he was a farmer and then he got government job. So that's what I feel, that a person from small village can come to Latur, a district place, and make his four children doctor. That is what is very creditable. And that's what I follow his path. I remember him day in, day out.
Dr. Kalyan, the fifth question that may be my last question, but prior to that, I just for those 42,000 gynecologists, I must say, I meet the person, I go with the perfection, and I go with the persona of the person is none other than Dr. Kalyan Baramade. Because the person when he stood on the podium, I mean he stood in the OT, the persona is different, but when he comes down to friendship, the persona is totally different. So Dr. Kalyan, the last question of me, that always I seen you as a gynecologist, as a good friend, president of IIG, now the VP of Foxy in coming years. So, what is the we like to see you as a MP or MLA because the organization skills and the bhaichara is so much in and around you because of your personality. So, what is that secret of your personality that everyone try to get attached to you?
Nothing. I'm a very simple person, and I'm really grateful to friends like you who give me that position of being a politician in future. But I'll tell you, doctors or educated people should come into the politics actively, and maybe in another 5 years you can see me there because I'm going to be working in Foxy for next 5 years, and afterwards I may retire and go into the political life itself.
Yeah, thank you, friends. It's a wonderful having my guest, Dr. Kalyan Baramadev, the president of IIG, and the Vice President of IMA. The few people, this is the last, maybe the last podcast of the year, but this is the, I may say, this is the one of the unique podcast wherein the legends actually come live and teach us what is the life is all about. So, friends, these are the persons whom we can take much more things to learn and to enrich our life in the future. Thank you for joining us live and thank you for being there. And Dr. Kalyan,
Last
it's
word
been
I'll
an
give for
honor for
all
me.
gynecologists. Last word, please practice safely. Any medical legal help required, Foxy is there, just phone call away, and people like us are there to help you all. Thank you.
Thank you, Dr. Kalyan. It's wonderful having you on this podcast. Thank you very much.
Thank you, Dr. Ashish Kale, sir. Thank you, Dr. Sunita, madam, for this opportunity. Talking on this podcast from a small place called Latur, it really gives me a pleasure, and I'm really thankful to Foxy for this initiative. Thank you.
Thank you.